conference will now be recorded.
So hello, everyone, and welcome to our presentation today on integrating intermittent pneumatic compression therapy in lymphedema management. My name is Jennifer Wang, and I'm the president of Paradigm Medical. We are a Canadian distributor providing healthcare professionals like you with top quality medical solutions. Our product lines include pneumatic compression pumps, truncal compression garments, and lymphedema footwear, all designed to support you in lymphedema, post-mastectomy, and orthopedic care. I'm delighted to be introducing our speaker today, Vignesh Velachame. Vignesh is an advanced practice physiotherapist at Kinte Healthcare and a combined decongestive lymphedema therapist. He is also an advanced clinical practitioner in arthritic care at the University of Toronto and an ADP certified compression garment fitter and certified pneumatic compression garment fitter. With his broad clinical expertise spanning physiotherapy, lymphedema, and arthritic care, as well as his experience with government programs, Vignesh is a leading authority on today's topic. Before we begin, please feel free to use the chat box to answer and ask any questions during the presentation. We will be monitoring the chat to ensure your questions are answered. Now with that, please join me in giving a warm welcome to Vignesh. I pass it to you, Vignesh.
Hi guys. I'm Vignesh, like Jennifer said. So this is the financial disclosure. I'm not receiving any funding from any external sources, including but not limited to the grants, sponsorship, or other financial assistance. That's my financial disclosure. And then about me, Jenny already told that. I'm training in advanced practice in arthritic care and also an advanced practice physiotherapist in the hip and knee clinic, Quinty Health. And I'm practicing privately combined decongestive therapy and a lymphedema therapist. And recently, my company got an ADP, authorized garment vendor and a fitter. And I'm a certified pneumatic compression garment fitter with Paradigm for the last 4 years, three plus years. Okay. And this is short about my educations regarding the lymphedema therapy and also the wound care. Sorry with a little bit of disturbances. I'm doing the online presentation in the UHN, Toronto Western Hospital, so I don't have a separate room. So I'm just doing it in the shared room. So you might be hearing little noise here and there, but please bear with me. So this is how all is started, the lymphatic clinic or the lymph clinic. So I started doing the home visits on 2018, and I found them, the clients having a chronic edema and the wounds. So this is where all the journey begins. So I started to learn more about the wound care through Ontario Physio Association. Then the COVID hit, so I couldn't able to complete the courses because all the courses suspended. So I'm searching some online. So the one slide clicks me during my wound care courses, wounds in lymphedema. So that's why my lymphedema journey begins. Then I started to do the lymphatic drainage since 2020 and till now. And the other challenge I face when I'm implementing this program is there is a gap between the people having lymphedema and to get the compression garment funding system. There is a funding system in place, but there is a challenge in getting that. So people from community like from Quinte West and Belleville, they need to travel Kingston, Ottawa, Oshawa, or Peterborough to do the garments. So I started to I started a business, lymph clinic. Then I started to register as an ADP fitter and then an ADP vendor. We got the ADP vendor status in recently June. So, and also when we are doing this process, one day a First Nation client visited me, and the client asked me how these therapies can help them. And so I dig into that. There is a lot of fundings for the NHIB, non-health insured First Nation community. The only challenge is we have to bring the people and we have to make them aware that this much of government supports is there. So it's still a challenge, but we started a Quinty equipment and supplies in 2023, and we are helping them since 2023. And during the past year, what I noticed is most of my clients having some past medical history, like an inflammatory conditions. So it put me an urge to learn what is a link between the arthritis and the lymphedema and lipedema. So I joined the course in Advanced Arthritic Care Program, and we are. I'm still as a trainee, but there's a lot of correlation between this joint instability, swelling. Uh, it's really interesting. There's a lot of things I'm finding out, and I'm uh, putting in some slides here at the end of the presentation, just to everybody to know. The lymphedema is not only it's a uh, it is common like what we didn't know, but it's more common that more than we expected. So, like I mentioned, the current activities, I'm still exploring the correlation between the arthritis, lymphedema, and hypermobility and lipedema. It's an ongoing process. I'm still at this early stage, but a lot of research is supporting. We will see. Maybe in future presentation, I can give you more insight about this thing. And I'm a founder of the Limb and Limb, so it's it's a business for the ADP approved vendor and fitter service for the compression garments, and also founder of the Quinty equipment and supplies to bridging the gap between the gap for the non-insured First Nations to get to access for the garments. Okay, today's agenda is we have to tell about what's the lymphedema and what are the treatment modalities available and what current practice I'm doing it in my clinic. And I'm going to present some case studies, mostly focusing on how beneficial the intermittent pneumatic compression is and what are the lessons and pitfalls I learned from my practice, and then the additional feed for your brain to explore what other conditions linked to the lymphedema and lipedema. So lymphedema treatment is an evidence-based. They report in House in 2024, he reported that the following interventions decreases the degree of the lymphedema and shrink the circumferences of the involved limb. Though it is not curable, but we can able to manage it and we can able to manage the limb health. So the first foremost is exercise, physical therapy, then the complete decongestive therapy. So that means we have to do the MLD, compression bandaging, compression garments to decongest the lymphatic accumulation, then the manual lymphatic drainage, and other invasive methods like the intermittent pneumatic compression, kinesiotaping, compression garment, laser therapy, depostulation therapy, and shockwave therapy. It's mainly for the fibrosis. So indications, when to do this congestive decompression therapy or manual lymphatic drainage. So when there is a limited mobility or moderate or advanced lymphedema, post-intensive therapy or maintenance phase, difficulty in tolerating compression, desire to improve quality of life, comfort, limb function, and emotional well-being. These are the main indications for the intermittent pneumatic compressions. So you guys already know the indications for the lymphedema is we can start early, phase 0, phase 1, phase 2, phase 3. But for the pneumatic compression therapy, it's an adjunct for the manual lymphatic drainage. And for the persons, those who are having a limited mobility or not able to tolerate any type of compression, we can do this intermittent pneumatic compression. So as for the intermittent pneumatic compression, the challenges in the treatment, the intermittent pneumatic compression is an adjunct therapy. We need to do it every day as per the physician recommendation or the specialist recommendation. So 1 to 2 hours a day, every day. Most of the clinics, in clinical settings, everyday therapy is still a challenge for the clients to come. And overall, a lymphedema patient or a lymphedema patient, when we say the first phase is the crucial phase to the decongestive phase, it needs a frequent treatment. In theoretical, it says like 2 to 3 sessions per week. It's recommended. Due to the financial cost, most of the person can't be able to afford those things. And second challenge is the cost of compression garments and wrap or bandages. So we have to initiate with the wrap and bandages to reduce the limb circumference, and then we have to advise to put a compression garments. During the initial phase, the limb size markedly reduced, so they need to change the compression garments at least 2 to 3 times, depend on the size. And again, it is costly, so it's not feasible or affordable for most of the clients. And the last challenge is prescription from the physician. To get a prescription from the physician or specialist, it's still a challenging process because the client has to come to us, we will refer them, and they have to wait for another appointment with a physician or a specialist. It takes another couple weeks to couple months. Then by the time they come back to us, it's almost it's double the size. It's very hard to manage the limb circumference. So those are the challenges in the treatment. So our clinical approach, in my clinic, what are the steps we used to do is when they come for an initial assessment, the first assessment is that we will try to incorporate the treatment if it's appropriate, and then review the exercise with the PTA. So what are the home exercise and self-massage technique, and then email every patient's self-MLD and exercise guide from the UHN network. And then encourage we recently started the exercise classes for the lymphedema clients. So we encourage them to participate in the exercise classes, and then book a follow-up appointment with a partner for the MLD training. So next, every second visit is mostly, we will encourage them to bring a partner or a caregiver. So we will teach the caregiver how to do the basic MLD techniques so that they can do it at home. They can be independent as much as possible. And if they are eligible, then we will refer to our ADP authorizers to fill the ADP forms. And then we provide a LOO funding links if they are eligible. And then we will give them a compression garment or intermittent pneumatic prescription form to the client to take it to the physician to get signed and bring it them or faxed between the next visit. So this way, we can able to manage. In this way, we can able to manage effectively. Okay, we'll go to the next slide. So to integrate this advanced therapy, we need to explore the suitability. Not all the techniques is suit for everybody. It depends on what condition or what's the major goal. Like for in case intermittent compression pump, we can use it for lymphedema and also for lipedema. But our goal is different. The goal first for the lymphedema is to reduce or maintain the limb circumference. But for the lipedema, our goal is to reduce the pain. So that's the goal we need to work on it. And the same thing for the taping, depostulation therapy, and low-level laser therapy. So this is a model prescription form we used to give to our client on the first visit. So they will take this prescription form along with the um, pamphlet about the intermittent pneumatic compression details. So they will take it to the specialist or the physician to get signed, and they can send it to on the next visit. Why it is needed is it is a medical equipment. It needs a prescription. How it is different from Amazon and other pneumatic pumpers. In Amazon or whatever the other open market sources, the pressure is not determined. It says low, medium, high. For me, low pressure is 20. For my colleague, low pressure is 30. For another client, low pressure is 40. So what is low? We never know. So Amazon pumps or open market pumps, uh, it's very cautious. It needs some medical advice to use those things. Um, so in our clinic, we have the garments. We can put up to 48-inch leg circumference. We can able to treat them. And for trunk, unilateral mastectomy, and post liposuction and post surgical edema, we are treating with a pneumatic pump. In special cases, we order or we customize, we'll reach the paradigm to get an extra size garment if it is needed. So the best practice for the intermittent pneumatic compression implementation is we have to do what's the device type and how pressure it needed and how much chamber it needed. Chamber, it can be 4 chamber or 8 chamber, 16 chamber. It's depend on what the stage of the lymphedema or what the stage of the lymphedema you're treating and what your goal is. And every time assess the girth, assess the condition of the skin and fibrosis, and educate the patient the usage and the safety. Always integrate with the MLD therapy, like the massage and lymphatic therapy. This is the golden standard till now. So our other therapies are just adjunct to the treatment, but incorporate the MLD. MLD is the basic. And document volume, symptoms, and skin changes. If you're not able to do this in my clinic, we used to take a picture, post and after picture, or every month or every 2 months once, take a picture and with the client consent and store it in the file so that they can able to see how they are improving. Always consider the other health conditions like any congestive heart failure, asthma. So those are the things you have to consider. Hypothyroidism, consider. And any acute exaggeration of inflammatory arthritis, consider that. Any other, like a normal thing, like a deep vein thrombosis, consider. It is all contraindication for our therapy. Open wound, it needs to be properly closed, and the infection prevention protocol should be followed. Then you can start doing it. Gangrene is a contraindicated. We don't want to put any compression pressure on the gangrene. Okay. So how the ICP machine works is, it's a non-invasive treatment. So it's just imagine about the blood cuff pressure, like a BP cuff apparatus. It's the same way it works, but it's going to work like a sequential. So sequential in the terms, it's going to start from 1, 2, 3, 4. So first the number 1 will fill, then the number 2, then number 3, then number 4. It's a sequential order. So always it follows the lymphatic pathway that is from distal to the proximal. Distal is the hand, from the hand, proximal to the axilla. So it follows from hand to axilla or foot to groin or foot to the chest. If you are wearing a biopant, it has from foot to the chest. So how it's helpful? It enhances the lymphatic uptake, and the muscle microcirculations. And the pressure, the constant sequential pressure is reduce the fibrosis and improves the skin, and it may modulate the autonomic nervous system too. So these are the actions for the ICP and how it benefits the lymphatic circulation. Oh, in our clinic, the weekly therapy structure is like this. So we recommend daily, but as I previously said, it is cost effective. No, sorry, it's not an affordable price. So most of the client usually choose weekly ICP sessions just to try it. When they see the benefit, we encourage them to buy like a home treatment. And we always depend on the condition. We do alternate deep oscillation or laser therapy every other week. And it's always tailored to the client preference and the responses. And we introduces the exercises, lymphatic exercise with the PTA, weekly twice for arm and legs. So those who are willing to join those classes, they can do the classes. Yeah. So when you wonder about how effective it is, this is just a single session. So when you can zoom and see that that's a client with a venous insufficiency and the glossy, shiny skin is the pre-treatment, and the normal skin on your your left side is the post-treatment, the one treatment session. When we do that intermittent pneumatic compression, when we put the garment to prevent the infection, we usually use a liner cloth. So recently we saw that ribbed liner cloths is more facilitate the lymphatic drainage very nicely than the normal liner cloth. You can see that ribbed line on the left side of the image. If the ribbed line directs towards the lymph nodes, so it's spirally and it's take it to the lymph node. So it provides a good facilitation of the lymphatic drainage rather than the normal lining cloth. Sometimes when you use the lining cloth, make sure it's not folded or it's not wrinkled. Too much folding or wrinkle also makes like a tourniquet effect. Make it a smooth, light cloth that's more beneficial in my, I noticed in my practice. Oh, this is a case study, a patient. All the names are just randomly populated. It's not related to any of the patient. So this patient, he has a 59-year-old lymphedema client. She was treated as a lymphedema for the past 10 years. When she comes to me like 2 years before, she's like cellulitis and is causing discomfort and mobility issues. So we recommended like weekly once MLD and intermittent pneumatic compression. Wraps and stockings. The client is not a good fan of wraps and stockings. She just wanted to continue the lymphatic drainage and the pump. So the next slide, you can see the progression. So this is the patient's outcome. You can see that the cellulitis patches, like the skin changes. So if she adheres a good leg hygiene, we can get a much better results. But she's not a good fan of putting the garments and the stockings on. But still, we managed to reduce the size of the lymphedema part, not the lipo. The fat part is still there. We can't reduce it with the pneumatic compression. So the edema part, we bring it under control. And now we educated her to adhere the wraps. So she's doing on and off, but she's overall doing good. And the next one. That's the client, 62-year-old. It's a pure lymphedema. You can obviously notice the one leg is bigger than the next one. So it's the progressive swelling. We recommended, we put here weekly once. That's the treatment we are giving it, but we recommended every day. And the MLD, every other week we started with, and plus started doing the wraps and stockings for her. And I can go to the next slide. Yeah, so now we can see that the first and the second slide, you can see the differences in the skin tone and also the size of the leg. Um, so the second picture, I went a little closer to zoom in, but still it looks better than the first one. And this patient has one leg amputation, the other leg having a recurrent cellulitis infection, and he's been a frequent hospital visitor. And when he referred to me that they were trying to the client can't come to our place because of the mobility challenges. So I tried to visit him. It's a 40 minutes drive. So I usually visit him on Sundays. Uh, he's in a palliative care, but we want to provide a better quality of life. So, so this is how the client we received with a tubing grip on, and here and there ulcers in the foot, and I can see the tubic grip indentation on the below the knee, and also lower 1/3 of the calf. You can see the indentation, and since he applied only the tubic grip, you can see the foot is swollen. So this is a perfect example of improper bandaging or improper um, compression garments. You can go to the next slide. So after the treatment and post-treatment, you can see the difference. This client adhered to the compression wraps, and still, well, I've seen this client for a year. Uh, we didn't bring much of the mobility, but we reduced the hospital readmission for cellulitis. So in the whole year, he got one episode of cellulitis. That's all he got. Previously, he used to visit the hospital every 3 months or 4 months once. The last 1 year, he got only one episode of cellulitis admission. Unfortunately, the client passed away last December, but we're happy to provide him uh, good, good care till in his last days. Next slide. This is a young guy. Um, you can see that by seeing the leg alone, you can't be able to say how much old this guy is, but he's just a 25-year-old. Typical lymphedema after the cellulitis. You can see the cellulitis on his right calf. You can see that healed ulcer. That's the one. So when he came to us, he can't able to work. He's on off work for more than 4 months. That's the time he came, and he's a good example for a client how to maintain it. So whatever we prescribe, he's adhere with it, like the compression garment, like the wraps. So he's stick with the treatment regime, and the next slide, you can see the result of it. You can see the result after the treatment. So this is, I can say in 3 months, able to get it this much reduction, and he back to the work. And he started with 3 times a week. Now he's doing every day. And he went beyond, and he bought a pump, like an investment. He invested in his health. He bought the pump, and he is using every day. And you can see the how the skin color changes, and how much. Like I said, even though my picture on the post treatment is closer, you can still see the difference. It's still smaller than the left side picture. The legs are still smaller than the left side picture. So that much improvement, he got it. Yeah. The next one. Oh, so the lessons learned. All these 5 cases I submitted. First one is the skincare. The client one. If the client not able to maintain the skincare, whatever therapy you do, it's just you can maintain, but you can't get the much effective result if the client is not doing her skincare. And establishing a goal is mainly important. All the big leg or big limb is not a lymphedema or a lipedema, so or of obesity or just getting fat. So you have to talk with them and establish a goal. For a lipedema patient, if you establish a goal of reducing the limb circumference, it's not going to happen at all. So you have to establish the goal, what you're working on, and yearly intervention with intermittent pneumatic compression, I felt it's a much needed. Like I show you in the last case, within 3 months you can able to bring it down, but the intermittent pneumatic compressions need to be every day. Um, then adherence to the compression. So some clients, they are not adherents to the compression. They think that okay, I can wear it for couple days and I will leave it for a couple days off. It won't work in the lymphatic world because till you breathe, the lymphatic will circulate. So there is a challenge in the circulation. That's the reason your leg is get swell or arm is get swell. So you have to put the compression throughout. Um, there is some exception. You can take it off at the night time, and you can put it on the daytime. And when you have a assessment with any of your lymphatic therapists, they will suggest you whether you are belong to that category or not. But without consulting with a therapist, and don't go and buy a simple open market, because it's hard when you started with a higher pressure, and every day we get old, yeah. So you might be needed only 15 to 20 pressure, but if you go to shopping in an open market and getting 40 to 50 compression socks and started to putting for 15 years, now your body will accommodate to that. So, and once you get old, it's hard to put it on also, and that time you can't able to put it, and you have to see the secondary complications. So always consult with the therapist before you buy an open market source. And it's an interdisciplinary approach. One person can't do it. It needs to be everybody to be there, like a lymphedema therapist, physiotherapist, wound care specialist, and physician. The local physicians are our the first person who can make your treatment successful. Like the guy I show you, we got in 3 months. That physician opened to the intervention. So when we sent a prescription, he signed. So we started it. So the local physicians or the main person, those who will make your treatment worth benefit, and also it can save a lot of money for the client too. And it's just for the feed for the brain, how the lymphedema and the inflammatory arthritis is linked. And you can see the next slide. Yeah. So it's been studied. So the rheumatoid arthritis having a lot of link with the lymphedema, since they're all like an autoimmune response process, and the lymph nodes and lymphatic channels, it helps in memory cells, storing memory cells, and fighting against the inflammatory. So it is interesting that psoriatic arthritis, systemic sclerosis, juvenile idiopathic arthritis, ankylosing spondylitis, SLE, dermatomyositis, all have a link with the lymphedema. So it is still it's an exploring field. They're still studying. It's not like once you have a rheumatoid arthritis, you might end up in lymphedema. No, not like that. But it's still there is a link is there. So if a client come multidisciplinary approach, just look for some new rashes, skin patches. If you suspect any psoriasis, just refer to the rheumatoid arthritis or arthritis specialist, or refer to the family physician. I noticed that because we are the one, we see the client's skin more depth, and we have more time to see observations. So just we can spend some extra skin patches around the neck and scalp, elbow, behind the knees. Just have a quick look. Then you just tell the family physician, hey, I might be suspecting some, can you please help us? Physicians are open to help us, so you can just, as a uh, as a therapist, we can always look for this. And then these are some of the drugs, disease modifying drugs for the rheumatoid arthritis. It's okay. When we discuss this, okay, if you we have a rheumatoid arthritis and we have a lymphedema, can I take the rheumatic arthritic drugs? It will cure the lymphedema? No, it won't do that. It's both are working on different things, different structures, so it won't help in that. Okay, and some interesting cases like uh, lymphedema and isolated lower extremity edema. So when you see that a lower extremity edema, it's in systemic lupus erythematosus flare. It can happen in the systemic lupus erythematosus too. So if you are having a patient with a one leg lymphedema, just ask about some butterfly rashes in the skin. Ask them whether any autoimmunity signs going on, any fever, any morning stiffness, any rashes, new rashes. Um, and when the swelling, especially in rheumatoid arthritis, polymyalgia, and giant cell arthritis, the people have some pitting edema, but this pitting edema is not a lymphatic change. So all the edema is not a lymphedema, but if you have a lymphedema, just go through that inflammatory cap and rule out some of the inflammatory thing. It helps the client in long run, especially if you see the pitting edema syndrome. Early they start the rheumatic medication, that's edema will go. So that's the best help rather than treating under us for a long every month session. Um, so the next one, there are some promising results like the new therapies. Some studies, they say it can improve the lymphatic vessel functions. They are all in phase 1 now. Maybe I didn't check the 2025 recent one, so maybe the last time I checked in the May for a presentation is they are still in phase 1 study. So hope in another 5 to 10 years there is a drug will come for a lymphedema, hopefully. And then next one, this is interesting. I noticed the lipedema and hypermobility disorder. So lipedema mainly the fat accumulation. It's not a like a lymphedema. One leg gets swell. It's both leg will swell, both hands will swell. Not a hand. Arms and forearms. Hand and feet usually escape from swelling. Then that is a typical lipedema. It's not a lymphedema. Lymphedema, you just imagine the gravity pulls the fluid, the feet is swell. Lipedema, just opposite. Gravity won't pull the fat down. So the feet is okay, but you can see the fat is hanging around in the body. So that is lipedema. So when I saw some of the lipedema patients, I noticed them, they are all hypermobile. So when I started searching some interesting thing about the client, they have no lymphatic dysfunction in the early stage. But when they advance to stage 2 and stage 3, because of the fat accumulation and the body changes, they might have impaired lymphedema. Not all the lymphedema patient will end up in lymphedema, but there is a chance. Um, they all have a excessive fat, excessive weight on the joint, and they are all uh, not they are all sorry for that. Most of them they have a findings for a hypermobility. They can extend the elbow beyond zero, or they can stand and touch the floor with both the hands without bending the knees. So it's so common. They all wonder why they wear a tight jeans or a tight shirt, because the tight compression provides them much relief. So you can notice them like they wear tight jeans or a tight pant, they feel it's more comfortable there. Then we can go the next one. So these are the hypermobility thing. So over 50% of the people with lipedema found to have a clinical hypermobility. So especially it's linked to a syndrome called Ehlers-Danlos syndrome. So you ask a couple of questions to the clients. If you suspect their skin is so hypermobile and all the joints are hypermobile, there is a clinic in the Toronto, so you can refer them. So like I said, it's an interdisciplinary, so um, they can prevent the secondary complications of the hypermobility thing. And why we are mentioning why we are mentioning this is lipedema. We will tell them to exercise. It improve the lymphatic functions in hypermobile people persons. Don't recommend a stretching exercises because they are already hypermobile. So you have to change the exercise. So refer to a physio and uh, modify their exercise. It's more helpful in lipedema. So even though both having a big limb circumference, both having little different approach in the treatment. And this hypermobility patient having an exaggerated joint disease and also aortic disease. So when you treat the lipedema patient, make sure to rule out any heart conditions. Okay?
Vignesh, we
And
just had a
like,
comment.
okay.
Just someone mentioned there was a webinar through the Lymphedema Association of Ontario regarding the pairing
Mm-hmm.
technique.
Yeah.
So if anyone else is interested in learning more about that, might be a good resource to find out some
Oh,
more.
yeah. Yeah, that will be awesome. Yeah. Yeah. Yeah, sure. I will look into it. Thanks for the sharing info. Yeah, that's the main purpose of the group webinar. So we can come up with new ideas and we learn each other. That's great. Awesome. Thanks, eh? And okay. So and okay. And then the last one is take home messages is uh, mostly we need a compression garments. Whatever therapy you need, it is not a substitute of the compression garments. We need to wear the compression garment, whether it is a lymphedema or lipedema. And it's how many months to wear, how many days to wear, you have to wear. You have to wear till the lymph circulation is running in your body. You have to wear that. So lymphatic drainage reduces the perceived edema and pain, ultimately enhancing overall function and quality of life. So, but no, I don't have a lymphedema. I don't have a lipedema. Is lymphatic drainage helps? Yeah, it helps. It's still pushing your bad fluid away back to the heart to get purified. So it still helps your body. And the key is early identification of lymphedema and timely access to the multidisciplinary care. It will prevent the irreversible lymphatic damage. So phase 0, phase 1, it's reversible. And when it goes the higher the stage, it's very hard to change it. And when it's irreversible damage occurs, then it is very hard to maintain also. So early identification is the key. So always think about interdisciplinary approach and feel free to refer to your back to your physician or your rheumatologist and get help from them. Any questions now?
Vignesh, I just had a question about compliance level. You'd mentioned that you often find patients struggle with compliance for compression garments. How are you finding it with the pumps, the intermittent pneumatic compression pumps? What's the feedback you're getting there?
The case 5, the guy, if you see it for a long terms, okay, typical example is the case 1 and the case 5. The case 1, the client is with me for 2 years, and we recommended within 3 months we told that, hey, pump is there, you can able to buy these other things, insurance will help. The client is not interested in it, and the case 5, within 3 months we made a success because the client got the pump and is doing every day the pump. So the key is consistency. If you see the affordability cost from the case 1 to case 5, both spend nearly the same amount. But the thing is, the first person he spent the whole amount in a extended 2 years period of time. The second client within 3 months he spent, and he's independent and he's doing managing himself. So every 6 to 8 weeks once he will just come to check me whether is there I am noticing anything that he couldn't find that. That's the only thing he's coming. So it's an investment. It's not like a you can't say it's like a waste purchase or it's an investment for your body. So my suggestion is if you get a pump and if your family doctor is okay with it and your MLD therapist is okay with it, get a physio, check the thing, and get a pump. And it's a medical device. That's one thing I want to mention again and again. So it's a medical device. We need a medical person to authorize a physio and a medical team, a physician to be um, responsible for that. So you can't go and buy and put a pump and you can do that. No, it is not a good idea. It's a medical device, so take with care, but it's a good investment in my view. Hope it's answer.
No, great, thank you.
Okay.
Because that's one of the major challenges that we see a lot is just compliance levels, making sure that people are getting daily treatment. And how are your clients finding? Because I know, especially with the pump, sometimes there's the upfront cost, but on a
Yeah.
on a long-term basis, are your clients finding it cost effective for them?
Yes, it's at the long term because um, it's it's available in if you have a machine, it's in your home, and you can able to do morning 1 hour, 2 1 hour, and if you are not able to do at 6 o'clock, you can still do it at 7 o'clock, and it's still circulation is doing that. The main misinterruption maybe uh, there's a false information like putting the pump accumulate fluid on the thigh or the accumulate fluid on the shoulder. So that's the main challenge. Usually the clients asks. Um, it needs to be addressed. That's the reason we need a physio or a medical doctor to be prescribed it instead of simply getting a pump from the store. So if you have a challenge in the groin area, you need a garment that cover the abdominal area. That's simple. So if you are a challenge in popliteal, then you can go a garment up to the groin because the groin is working fine. You can still do it. So if you are a challenge in the axillary lymph node, don't go with the truncal thing. If there is a full removal, go with the vest with a hand, sorry, with the arm. If there is only partial removal, then you think about only the arm. So it's like choosing the right compression garment is the key for the adherence also. So if you choose the right one and give it to the right client, they will adhere with it and they will stick with it and they like it because it's relieve the pressure and when you see the pressure, it's not a volume reduction. The first, the patient appreciate the pressure of relieving the heaviness. So once you put the right garment and the right pressure, the consistency, the adherence to the treatment is right. If there is any challenges or any deviation in choosing the product or choosing the garment, that's the time client will be like not satisfied with the treatment, and they find it's a huge investment. And yeah, so if you explain them, and if you tell them what is the pros and cons, and also it's like for First Nations NHIB, it's covered like at least more maximum amount is covered, and then most
And
of the
that
insurance they cover
NHIB is a national program, right? It's across Canada.
national program
Yeah.
for the First Nation around Canada, so it's covered. The full cost is covered, and then for the other insurance up to 80% is covered, and then some insurance 50% they covered, but it's most of the insurance 50 to 80% covered. And if it's a primary lymphedema, you can go to the ADP process, ADP clinics in Toronto. They will, the government will cover 70% to 80%, I think so. I'm not sure about the pump coverage in ADP, but it's only for the primary lymphedema, not for the secondary lymphedema. So those are the coverage options available. And yeah.
Yeah, so there's private insurance coverage, you're saying up to 80%, and then for primary cases, ADP, this is regarding the pneumatic compression pumps.
Yes,
ADP
it's a
does cover
pneumatic.
for primary lymphedema, and it could be up to 100% depending on income base, but
Yeah.
generally it's around, yeah, that 70 to 75%-ish kind of range through the ADP program. But that's specific to Ontario.
Yes, it's Ontario.
Yeah, Ontario patients.
Yeah. I have some more messages.
Yeah, we had some. I've been kind of working through them.
Okay.
I will ask another one. While everyone's kind of thinking about their questions, how are you finding the pneumatic compression pumps when you're treating fibrosis? Maybe if you can share a little bit of some techniques and some feedback and findings that you are seeing in your practice.
Yes. Yeah. If you the slides we can go behind if it is possible to take the before the case one before the case one can go
Yeah,
back. Go
so
back.
I'll go back. And in the interim, while I'm scanning back,
Yeah.
there's a
Okay.
question from Alan about, does ADP not cover the pump for secondary lymphedema?
Yes, ADP is not covering for the secondary lymphedema.
Yeah, so that's correct, Alan. ADP
Yes.
does not. It
Yes.
only covers the pump for primary.
Primary. Yeah. If you're able to zoom the second picture, that one, can you able to zoom it or no? If you're able to zoom,
Is that
yeah,
better?
okay,
Okay.
yeah, that's right. So I usually use the ribbed cloth. You can see the linings. So this is best for the fibrosis. I won't normally increasing the pressure for the whole area, but if you, especially with the biocompression from Paradigm, we can choose the areas like level 1 and 2 chamber. So this one, if you do the chamber 1 and 2, the foot and the thigh will be specified, and we can focus more time on that. So with the ribbed cloths, so it will loosen the scars and it loosen the fibrosis. So I prefer the putting a ribbed cloth under the fibrosis and increase the focus point of where you want to focus. It provides a better result. Oh, sorry. Sorry, it's just yeah.
Okay, so that's
Okay.
interesting. So this is while you're pumping, right? So you're saying you're putting
Yeah.
a rib cloth underneath the garment,
Under the
and
fiber.
then you pump with the rib
Yeah.
garment underneath there. Okay, and that you're seeing that effective with the fibrosis.
With the fibrosis. Yeah.
In addition, you are using the 4008 pump that allows you to adjust the pressure in
Yeah, and focus on only
specific.
those parts.
focus on
Yep,
specific
you're right.
areas in
Yes.
okay, interesting. No, that's great feedback.
Mhm.
Instead of increasing the pressure, you're saying.
Yeah, increasing the
Okay,
pressure, you can just use the focus thing. That will be great.
wonderful.
Yeah.
Also, I'm going to send a message to everyone about the Perrin technique. I know there were some questions regarding that. We've got a link. Thank you, Nipasing. So I'll just send it a link to the Perrin technique by Dr. Raymond Perrin for those of you who are interested to learn more. And then as well, I know Vignesh was mentioning a lot of the challenges that people run into where patients aren't happy with treatment when using the pump is a result of the garments not being properly fitted or
That's right.
uh,
The,
so for those of you who are interested in learning more about how to properly fit garments, Paradigm Medical does offer a training program, a certificate training program, to make sure that you're up to speed and you're making the correct recommendations when you're seeing clients. So Alan, just I know you're having some troubles with the link. I will send that out in a follow-up email so that everyone will have it. So don't worry about it. We'll follow up later with an email so that you have the contact for the Perrin technique. And Vignesh, are you finding challenges with patients getting prescriptions? That's one of the
yeah.
areas that we do hear a lot of feedback from.
Mhm.
It's just what's the best process and how to overcome some of these challenges when it comes to making sure that patients are properly diagnosed and have the prescriptions.
So in Ontario, we can't able to diagnose a condition, but when you suspect it's a chronic edema is a nice term. So if it is more than 3 months, then it's a chronic edema. So you can type a model prescription like mentioning it. The so and so client under the mutual client he is having a chronic edema, and then you suggest the pressure like from 30 to 60 pressure, or once you attend the training and you can know how much pressure, but usually I prescribe like 30 to 60 pressure. Then where to apply and how much minutes, you can just fill it the form and leave it like the prescription form showing in the paper. Then along with the prescription paper, send the document like send the pamphlet how the intermittent pneumatic compression therapy helps us, what are the conditions. So you can ask the pamphlet from Jennifer. She will usually send to us. So make a copy and send to the doctor when you are initially starting this process. So once you get a repetition, or once the doctor sees the improvement, then the next time no needed. So when I started in 2022, I usually send a pamphlet and along with a letter. And now the letter, I'm just faxing it, so they're replying it back. So once you get that uh, repetition, or once you get that, the physician knows that this is helping their clients, then it's okay. Then the first time it's hard, so make a prescription pad, and then with the information sent to the doctors. So then show the results. That's the main thing. So take a picture pre and post ICP, then send the pictures. Sometimes doctors are busy in schedule, physicians busy in schedule. They don't have time to evaluate all the process, or they have to wait for another physical to check everything. So in the meantime, you can just send the pictures along with it. So it will be helpful. So I usually tell them I won't take the responsibility to take a picture and hand it myself. So I will get the picture phone from the client to take a picture, date, and save it in the file. After 2 months, take a picture, save it in the file, and I will tell them, okay, when you go to the doctor, show it that improvement. So they are happy to show them.
No, that's a great tip. Um,
Yeah.
and I think it speeds up the process and kind of helps people understand the effectiveness of the treatment. We have another question from Alan. Where can you get the ribbed fiber that you're using with the pump?
Okay.
That,
Um,
that
okay. That's an interesting story. Hope you guys have a time. So I saw the ribbed cloth. In one of my client coming to the, I work in a hip and knee clinic. So one of the client came with a ribbed cloth, tight ribbed cloth. Uh, After 1 week of surgery, the swelling is expected. Very rarely won't be any swelling, but the swelling is expected after 1 week of surgery. This client with no swelling, nothing. I asked that, are you doing any MLD treatment or any treatment, any compression thing? So she told her, no, I'm just wearing the same thing for 7 days. So that's a ribbed cloth. I saw that it's a spiral ribbed cloth. Then I'm like, okay, why can't we try that in our client? Because in my clinic, to prevent the infection control, we usually wear the pajama pant, socks to put it on the under the garment, thin liner under the garment. Then we have to wash it. So this one we tried. We asked them where she got. She got it from Giant Tiger. So we went and bought all the Giant Tiger's ribbed cloth, and then we did it. It worked perfectly, and it's better, $14, $15, and yeah. So then it's once it started working, what I did is, okay, we now the Giant Tiger rib cloths are going straight, but the lymphatics we need a spiral one. So I gave one of my local sewing person to change the ribbed cloth a little bit, like in an angle. So they stitch it for me, little angle, and now it solves the infection control, and also it's delivering the lymph, uh, pushing the lymph nicely. So 2 in 1. So you can get any rib cloth from the stores and tell them stitch it like a pillowcase, but tell them to stitch it in a little angle. So they will do it in a little angle so that it follows the lymphatic channel pathways. Hope I answer it, or
Yep, Alan said, awesome, thank you.
okay, awesome, yeah.
There's a giant tiger close to him. um, and then there was another, some feedback about the pairing technique, mentioning that it involves congested cranial and spinal movement of lymph fluid for all types of conditions. According to data, it is very effective technique therapists can add to their treatment plan for lymphedema. That's just a comment that was made.
Yeah, it's an evolving field, eh? So right now the gold standard is MLD. I always tell my client like, right now it's a gold standard. It's after 20 years when you come, maybe one pill will solve all the issues. That doesn't mean that that this technique is wrong today. No, this is the only standard technique right now. Tomorrow there is another field will come. Day after tomorrow another field will come. So it's our duty to learn all the techniques and which one is best suitable, and like a webinar we can come and share our knowledge. Then we know from each other which one is productive for which client, and we'll go from there.
Yeah, and I guess another point to mention is that it's important to, after prescribing and a patient is using the pneumatic compression pump, is to have ongoing monitoring to ensure that if any changes in their condition, the therapist will be able to continuously monitor to ensure that there's no contraindications or things of that sort that pop up down the road. And that the pumping is an adjunct to the MLD and the complete decongestive therapy. So, any other questions? I know we're coming up to we're a little past the 1 hour mark. But if there's any questions, I guess we can, Vignesh has a few more minutes, but otherwise we'll have to end the webinar, and feel free to follow up with us afterwards. Let me just get all our contact information up so that you can find us if you do have any questions after the presentation. We'd be happy to assist you. Nipasing mentioned, I've always gotten great results with the pneumatic pumps. It's too bad ADP doesn't cover the pump for secondary lymphedema. Absolutely. It's something that we've been all working on for many years. So if you, I'm sure ADP would love to hear from you too as well, based on your feedback, and hopefully we can get that coverage extended to include the secondary lymphedema patients. The pumps are covered in Saskatchewan for both primary and secondary lymphedema. So if we can use that as a benchmark, as a case study for Ontario, hopefully we can add that additional coverage too as well. So if there's no other questions, I will wrap it up. For additional information that you'd like to learn about pneumatic compression pumps, whether it be finding a local dealer, if you'd like to become a dealer yourself, or to take the pneumatic compression fitter training and certification course, please do contact us at Paradigm Medical. Mina, who sent you the dial-in information, the webinar link, and the invitations, you can just respond to her and she'll get right back to you. If you do have any questions after this conclusion of the webinar, we would be happy to hear from you. So with that, thank you, Vignesh, so much for taking the time to spend and to share your wonderful feedback. I know you're a very busy man, so we appreciate you carving out the time today. Take good care of yourselves, everyone, and we hope to hear from you soon. Have a wonderful day. Bye-bye.
Okay, thank you guys. Bye-bye.